Hello, I am Dr. Michael Sebastian, a consultant general surgeon working in UAE. I am making this video to convey a very important a message which may help many people to reduce the incidence of chronic illnesses. 80% of the chronic illnesses that we suffer from is related to a condition called insulin resistance. I'm sure many of you may have heard about insulin resistance. Insulin resistance is a condition in which the insulin which is circulating in our bloodstream has, to put it simply, lost its efficiency. The role of insulin, as we all know, is to reduce the glucose levels in our blood. Insulin acts as gatekeepers and help to push the circulating glucose into the cells of the liver, of the muscles, of the brain, and other tissues, thereby reducing the glucose levels. Because of a peculiar situation, especially in India, where people are on a predominantly high carbohydrate diet, or in other words, predominantly high sugar, high refined carbohydrate diet, and also to other problems like obesity, sedentary lifestyle, chronic stress, lack of sleep, use of seed oils which contain omega-6, and consuming a lot of processed and ultra-processed foods, the insulin levels in our blood remain chronically elevated. As a result of this, insulin loses efficiency. To put it simply, suppose we need 10 units of insulin to keep our blood glucose normal. When we reach the state of insulin resistance, it goes very high, 5 to 6 times the normal. For example, the normal fasting insulin should be 6 microunits per ml, but in a person who has insulin resistance, it may go up to 30 or 40. And if you do a glucose tolerance test along with insulin levels, you might see a pattern in which the insulin levels remain very high in the maybe 400 to 500 microunits per ml, which are maybe almost 7 to 8 times the normal to keep the glucose levels normal. I'll show you an example of a report from UAE, from a report from a 12-year-old child who was investigated, and she was found to have this pattern. If you have a look, you will see that she has high insulin fasting, and 1 hour afterwards the insulin level is around almost 450, and after 2 hours it is around 415. Manyfold the normal. And see how the blood sugar is remaining constantly in the normal range. You will see that the fasting glucose is 82, and 1 hour after GGT with 75 grams of glucose is 141, and At the second hour, it is 415 and the glucose level is only 100. So you just see how very high levels of insulin is keeping the blood sugar levels low. That's why HbA1c, the 3-month control, is also deceptive, because a person with insulin resistance may have a normal HbA1c for a very long time, but very high levels of insulin is keeping those levels low. So the problem with insulin resistance is that you may be insulin resistant for 15 to 20 years before we develop the diseases. For example, I'll give an example. Suppose you consider that a tap is open and water is flowing on the floor. The open tap is insulin resistance. The open tap with water flowing out can we say insulin resistant. And the open tap is insulin resistance, and the water which is flowing on the floor is all the chronic illnesses related to insulin resistance. For example, what are the chronic illnesses? I'll give you the most important ones, which are type 2 diabetes, ischemic heart disease, hypertension, cardiomyopathy, cancers, many cancers including breast, colorectal and prostate, shortening of telomeres, which result in cancers and aging, obesity, visceral obesity, migraine, dementia, Parkinson's disease, Alzheimer's disease, stroke, peripheral neuropathy, osteoarthritis, polycystic ovarian disease syndrome, erectile dysfunction, non-alcoholic fatty liver disease, gallstone disease, gout, sarcopenia, increased inflammatory states which can cause conditions like acne, sometimes psoriasis, and reducing the body's ability to fight infection. If you look at the people who have died from COVID, majority of them had insulin resistance. Now, lastly, this is what I would like to say, which might sound surprising to you. Lastly, the side effects of all the medications we are forced to take in order to treat the diseases caused by insulin resistance. Just imagine that. I have an example of a 60-year-old, very dynamic person who was a businessman back in India, who went from a very mild head injury to a very severe injury in a space of about 2 to 3 hours. And the reason for that is that he was taking a combination of aspirin and clopidogrel. So he had a stent inserted maybe about 5 years back, and the doctor told him to just continue taking aspirin and clopidogrel, which is standard practice, I suppose. And now he's in a vegetative state. Look at that. A very dynamic person is now in a vegetative state. So that's what I want to say. A lot of side effects are there with all the medications we take. So, what is my recommendation? As I said, insulin resistance starts probably about 15 to 20 years before you're diagnosed with any of the conditions which I mentioned, and there are many more. So suppose in a recent recent breast cancer conference which I attended in Abu Dhabi, when we are talking about lifestyle and we are talking about how we can screen effectively, I strongly advocated that the most effective screening to prevent breast cancer is to check for insulin resistance. And if insulin resistance is there are ways in which you can reverse it. For example, there are many studies which shows that if a breast cancer survivor If she made modifications in her lifestyle as related to healthy diet, exercises, the recurrence rate is much lower as compared to people who are not taking lifestyle precautions. So what has happened there is the same as it's happening in insulin resistance, because the healthy lifestyle probably reversed her insulin resistance so that the recurrence rate is low. The same thing, that suppose you can screen a female when she is, let's say, 20 years of age for insulin resistance, and if found to be, and invariably found to be insulin resistant, then there are so many ways and so many modifications you can do with your lifestyle related to diet and exercises, which can reverse this condition. So, if you remember, I projected before a typical insulin resistance test. Fasting is high and the 1 hour, 2 hour values are also high. You may think, oh, how can it happen in a 12-year-old? I can tell you. You just go and screen all the 12 to 15-year-olds back in India for insulin resistance. You will be surprised to find that at least 75 to 80% of them have insulin resistance. So what's the best way to prevent insulin resistance and all the chronic illnesses and cancers which seems to be rampant in our country? What is the best way to do it? Is to screen for insulin resistance. My recommendation to the government of India and to the healthcare authority is that we should start screening everyone at the age of 15 probably for insulin resistance. And if they are found to have insulin resistance, then it's so easily reversible. And I'll show you which tests are recommended to check for insulin resistance. Okay. The most important test is what we call the HOMO-IR test. So if you look at it, HOMO-IR test is calculated by taking your fasting insulin, multiply it by the fasting glucose and divided it by 405. If it's the SI units, the calculation formula is different. You have to divide it by 22.5. Now, what is the other test? You can proceed to do a glucose tolerance test along with insulin if you want to confirm it. That's also an easy test to do. Then an indirect formula or an indirect test which can show that you may be suffering from insulin resistance is what is called the triglycerides divided by HDL ratio. It should be less than 1.5. And of course, measuring the abdominal girth, very important. Increased abdominal girth is indicative of visceral obesity and fatty liver. Visceral obesity, we can an easily formula to find is that visceral obesity multiplied by 2, if it is more than your height in centimeters. Visceral obesity, the waist circumference in centimeter multiplied by 2, and if it is more than your height in centimeter, then obviously you have visceral obesity and insulin resistance. Ultrasound for non-alcoholic fatty liver disease. You see, we know that non-alcoholic fatty liver disease is the most common cause of liver failure now worldwide. It was unknown maybe 40 years, 30 years back. So these are the things which we can do for screening, but the most important and simple will be to do a fasting insulin with a fasting glucose and calculate the HOMO-IR ratio. And this we should do in all the children starting from 15 years of age. Of course, anyone can do, but this is the recommendation. Now, if you want to know more about insulin resistance, I would suggest that you watch the podcast in the YouTube. So many are there by these 4 people. whom I respect a lot, who are Dr. Benjamin Bickman, Dr. Robert Lustig, Dr. Jason Fung, and Dr. Casey Means. Now, I find these people to be the most authoritative on the subject, and we can also see that these people, if you listen to them, you will see that they are really motivated to change the world, to make the world happier, and that's why I recommend them strongly. Also, if you want to have more information on insulin resistance related topic, I would suggest that you also go to the website, this website, and just go to the blog. Just go to the website of bodyvitacoach.com and then just click on the blog, and you will see many topics related to insulin resistance and how we can prevent it and how we can do it. So he'll ask you, okay, you have insulin resistance, how can you reverse it? It's very simple. In children, it's best if you can avoid giving them sugars from the very young age. Avoid sugars and sweets. Try to avoid all the sweet drinks, all the bakery items, all the biscuits, everything. They are all refined carbs and have high levels of sugar. And all processed and ultra processed foods. You can change into a very healthy diet. That's very simple. I'll concentrate more on the adults. If you are an adult and you have insulin resistance, the simplest way to do it, to reverse it, is you go on a low carb diet. Now, we have been classically taught that carbohydrates are the predominant nutrient which you should take, which means, if you know the pyramid, which all medical students or most of the people know about it, with the base is the carbohydrates, which is recommended all over that you take 60% of your diet as carbohydrate, which I would say is one of the reasons why insulin resistance has become like an epidemic. So, what is the best thing? My advice is to, instead of the pyramid, it should be a cylinder divided into three, where you take 33% carbohydrate, 33% proteins, and 33% fats. Now, and concentrate on one thing. Only take complex carbohydrate. So trying to explain what complex carbohydrate is it's a very big topic. So what you should do is just research on that. What are complex carbohydrates? What are the complex carbohydrates that I can see? So go for a low carbohydrate diet. Take healthy fats. So many things, so many are there. Just Google and see what are the healthy fats you can take and the healthy proteins. Just concentrate on that. Try to take only whole foods. Don't go for processed and ultra processed foods. Okay, forget that. This is something which you can find out, and I can assure you in that blog, and if you listen to the discussions, you will get enough and more discussions of the doctors which I spoke about before. You will get a lot of information on that. Now, intermittent fasting. So the second thing is intermittent fasting. I was able to reverse my insulin resistance mainly through intermittent fasting and exercise. Of course, a low carbohydrate diet and concentrating only on the only on the healthy carbs, healthy complex carbs. Then intermittent fasting. I try to take only 2 meals a day, majority of the days, which means I have a very good low carb breakfast, which invariably usually includes an avocado and a very healthy multi-vegetable omelette. And then I take my next meal when I return from work around 5:30 or 6. I take again a low carb diet. And if you want to take more carbohydrates, it's recommended that you take the carbs in the evening. And then try to avoid eating after 6 if possible. I know it's very difficult to say that, but it's difficult. So low carbohydrate diet, intermittent fasting, and the third and the most important is exercise. Exercise, as you get old, it's said that after age of 30, 40, you lose the 3% of your muscle mass every year, which means that's one of the main reasons why as you get elderly you become weak and you need help from someone to help you, because you become frail. The main reason for that is you lose your muscle mass. So it's very important that as you get old you should not lose your muscle mass. And how can you do that? You can do both cardio, which means walking. Unfortunately, majority of the elderly in India only walk. They don't try to do other exercises. It is recommended that you should do exercises for every muscle in your body. Upper body exercises, lower body exercises. Weights you should do. You should do whatever is recommended. You should go to the gym if needed, or you can have a gym station at home and do this exercise regularly, because you have to maintain a good muscle mass if you aim to live a long, healthy life without depending on anyone. I am sure that if you do that, you will maybe live up to whatever age, let's say 90 or 100, and you will be driving when you're 100. It's not a joke. Or you'll be running up the steps when you're 100. This is not something which is impossible. It's just that it's your state of mind. And if you determine that mindful living, meaning that you mindfully eat what you like, what you should, you are mindful about that, and you're mindful about your exercises, then you can do that. So low carbohydrate diet, intermittent fasting, exercise, and you can easily reverse that in children. So my recommendation to everyone is that please start screening for insulin resistance when you're 15 years onwards, or 12 years is fine. If you can do it at 12 years, that's the best. The earlier you catch it, the better. So if your children, just find out, and once you find that they are got insulin resistance, then it's an open discussion, because it's very clear. You can either be very unhealthy in another 20 years, or you can be totally healthy up to 80 or 90 years without getting any of these chronic illnesses mentioned above. And since all cells in the body have insulin receptors, this high circulating levels of insulin cause damage to all the organ systems in our body, and this over a period of many, many years translate to all the chronic illnesses which we see. In fact, what modern medicine is doing is just mopping the floor. Modern medicine is just treating the symptoms of insulin resistance, which are all the diseases caused by insulin resistance. Modern medicine is not curing the condition. Closing the tap is reversing insulin resistance, and this brings permanent and long-lasting health benefits. So with this, I am stopping. I hope my message is clear. Thank you for your patience.